Hello and welcome back to Medical Compliance with Clarissa. I'm Clarissa Benfield, our Global Director and Business Line Leader for our Medical and Laboratory Business at Intertech. And today I am thrilled to be joined by our special guest, Mia Spiegelman. Hi, Mia. How are you?
Great. How are you?
Wonderful. Thank you. So excited to have you joining us on the podcast today. As always, I love to give our guests an opportunity to introduce yourself, tell us a little bit about your background and how you ended up where you are in the medical industry.
Sure. So I originally wasn't aware of this regulatory and quality industry. They don't really train or tell us about this in high school. So I graduated at York University in Toronto, chemistry degree, and then a little bit of a early midlife crisis. I didn't know what to do with that degree. And it just so happened that Seneca started college, this post-degree certificate. So jump on that bandwagon and have been traveling it ever since. I started with pharmaceutical first for a year or so, and then I moved quickly to medical devices, and I've been working in different companies, regulatory quality. I did a bit of a stint with cosmetics, and then back to regulatory quality around medical device importation, distribution, all within the Canadian healthcare sector. And a couple of years ago, I had an amazing opportunity to join Medtech Canada in the current role. Recently, my title did change, so now I'm the VP Regulatory Quality and Environmental Affairs for Medtech Canada.
Yeah, which is so wonderful. And it was great. Of course, we were at the conference a few weeks ago up in Toronto. It's really amazing to see how far MedTech has come in Canada in general, right? And just having the event there was really exciting. And I think we've seen a lot of rapid development in recent years, which is really exciting to see, right? When we think about the overall North American landscape, right? We really have a lot of development coming out of the Canadian market. And of course, you have such an interesting perspective, being that you've, participated in several different points and areas of the industry.
Yeah, absolutely. It was a great event. I think it blew our thoughts and our imagination. I think everybody was happily amazed and surprised at all the participation, and we look forward to having this happen again in Canada, not this next coming year, but on an ongoing basis.
Yeah, absolutely. Well, today we're going to talk a little bit about the MDSAP program, Medical Device Single Audit Program, right? Something that you're intimately familiar with. And so I heard that recently there's been some initiatives in respect to the MDSAP program and some industry feedback that's been taken back to both regulators and the registrar. So maybe you can give an overview or an introduction into what's been happening with MDSAP over the last couple of years.
Sure. So, MDSAP is something I was aware before I joined Medtech Canada, but one of the things that when I was in industry is really implementing it within the companies I worked in, not so much of having the really the ability to sit back and identify areas where we'd like to provide feedback and improve on it, because like any quality system, ongoing improvement is something that is intrinsic to it and important to it because we evolve, healthcare evolves, our needs evolve, the regulations evolve. So when I joined Medtech Canada, I was actually approached by Health Canada to participate in the forum in Brasilia in 2023 in October. And my first thought was like, what is this? So again, I was always on a journey of learning and appreciation for being invited. So the five countries being Australia, Japan, Brazil, US, and Canada, and other affiliates were going to Brasilia to talk about MDSAP, and they wanted to hear from industry. So I quickly, not a lot of time, but I quickly gathered some feedback from our members. Obviously, we hear when we're in industry about challenges or benefits, but we didn't have an opportunity to kind of put it all together. So I reached out to our members and really appreciate the collaboration and participation of our members that provided that feedback. We presented it in Brasilia, and we presented again areas where we thought it was doing excellent and areas where we would like to provide some feedback to improve on it, because again, it's always in a state of flux and evolution. So the feedback was absolutely amazing. I mean, they appreciated the feedback. It was as much as possible with a short amount of time data driven, which I think it was very helpful. And then after that, I was tapped on the shoulder by TGA, which is our Australian Association, to join MTAA, which is the Australian Trade Association. TGA is a government, regulator, and then worked with them and the TGA to do the evolution of 2.0 of that survey, which we presented in Essen last year, in which we had much more data, a broader survey, 65 questions. No, you don't have to answer all of them, obviously, but the total was a lot. And our concern was it's an exhausting survey. Will members wish to answer it? And we were just overwhelmed with a response. We presented the data, and we recently received feedback from both the regulators and the AOs, or we call them also registrars, that they would like to participate in the next iteration, because the whole purpose of this survey is to capture wins, celebrate them, capture trends, signals, resolve them, and improve on them. Because as I keep on saying, we always evolve, we always change, and there's always room for improvement within the system. So it's been great so far, and we're at that point right now where we're gathering. Now that everybody has said yes, we're gathering the industry, we're gathering the AOs, we're gathering the regulators, and we're waiting to plan the next evolution of it and meeting and kind of how will this work out in the future.
Yeah, I think that's just amazing, right? To see feedback actually being taken in, data driven, right? As you say, which is so important. And then using that to improve and evolve and change, right? Which is so important. I know you mentioned in there too, right? There's some really big benefits that you saw from the data that you gathered, right? What people see as benefits to the program, as well as some challenges. What are some of those things that you see from, more of an industry perspective, maybe related specifically to the challenges or really strong benefits that people are seeing with the MDSAP program?
Yeah, thanks. So like anything, there's always pros and cons. I would say that the challenges, I would say, I can call out four of them, but three of them are something you will find with any QMS implementation, quality management system implementation. So it's no different. The first one will be the three of them that are the same are cost, effort, and timelines. Whatever you do, whatever you implement, there's going to be a cost element, an effort element, and a timelines element to implement it. And so really, I can call them out, but that would not make you choose MDSAP versus something else. Sure, the costs are depending, and some people might say that the cost to implement MDSAP a little bit higher, but there is also benefits on that. So costs are a challenge, but they're a benefit, interestingly enough. So the implementation might be a little bit more costlier, but if you think about the cost of implementing a quality system, it's not only the cost of the certificate, but it's the labor cost, is the time cost, is often production line cost, is the repetition of it 5 times every year. Those are costs that if you calculate it, in fact, the net effect is an actual reduction in costs.
Absolutely.
It's just people see the ticket, they don't realize how much it saves you in the long run. And I wouldn't even say the long run, that first year already saves you that and more. The one, and obviously effort, you have to put an effort into creating a quality system, and that you can only assess the effort based on where you are and where you need to go. And that's every company has their own journey in there, depending where they start. And the timelines, of course, again, it depends on where you start, where you have to go. And that's your own personal journey. The one thing I would say that was a bit of a surprise to me as I learned about it is simply the fact that you can pick, which I mean is that if you're selling into the US and you don't have MDSAP, and now you want to sell into Canada and the US, and you want to get an MDSAP, you can't say, well, I'm only going to do it for Canada because the US already have something. You have to actually add both countries onto it. So it's kind of like an all or nothing, which makes kind of sense because one of the benefits of MDSAP is that you reduce audits. You don't want to still have 2 audits when the whole purpose of MDSAP, a medical device, single audit program. It kind of contribute the whole purpose of it. So anyway, so that will be the only thing I would say. It's a bit of a challenge because, you kind of have to shift a bit, but it's not a big one. It's just a matter of reassessing what does this mean and putting into your plan or change control plan. The benefits would be, as I said already, a reduction in costs. People don't, when they hear about it, well, what do you mean? I heard the opposite. Well, no, it's actually a reduction. Also, you have multiple access points. You get that MDSAP. If you get it for all 5 countries, you get it for all of those 5 countries. That is an amazing thing, and then that next thing you need to do is get your license, obviously. The one thing I would say when in Canada, we started the journey much earlier, right? Because we had ISO 1348588, and then we had CAMDCAS, and then MDSAP. And one of the things I appreciated was the ability to choose my AO and my auditor. I interviewed them to make sure that we can understand them, as in they understand our industry, that we have it's a working relationship, that we connected from a working relationship perspective, that we liked our AO point of contact. So these are things, and we have choices. We have 15 choices right now of AOs, and with them more choices of auditors. So I would say that's a benefit, that you can't pick your government auditor. So anyway, so that's a benefit. No surprise audits. That's something that, I mean, we talk about MDSAP being a single audit program. It doesn't mean that you're never going to be audited by a regulator. There are reasons why they are going to audit you despite of having an MDSAP, but those are specific, unique, and far in between. So by vast majority, it will be a single audit program. So with that, again, that would reduce your costs, because it's disruption to your business, et cetera. So that's a benefit. And streamlining compliance. I mean, if you get audited by 5 different auditing regulatory bodies, they'll have 5 different opinions on the same quality system, irrespective of the different regulatory requirements. So it's also sometimes hard for a company to meet the needs of 5 different people, because quality is sort of like, it's based on regulation, but it's an art as well, and it's based on the auditor's experience. So it's a bit more challenging to meet these. So with it all streamlining through one auditor, one audit, it reduces that. So it's just one point of reference versus 5. So that also helps the business.
Yeah, I think there's so many things that you highlighted that are such strong benefits of the program. And I think the most being right what you said, which is, once you sit down and really take a look at it and how much time and resource people are putting into different audits, working with different regulators, right? How much time that takes. It may look like, oh, this is going to cost us more, but when you really lay that out and see, okay, how much effort are we putting into this? How many different individuals' times are being pulled into these things? Multiple audits a year, right? Once you take that all into consideration, it's like, oh, it's kind of a no-brainer to say, if we can, let's do it, right? And go for the single audit program. But with that, we see, some of the maybe smaller manufacturers or smaller companies, those which have, maybe limited resources, having a bit more of a challenge than maybe some of the larger companies who have big teams and lots of resources. So are there things that you've seen on maybe more of the smaller end of the spectrum with companies, challenges or hurdles that they've had specifically because of their size, and then anything that maybe they could do to make it an easier process or a more smooth process for themselves?
Yes, absolutely. So I can give a couple of examples. One of them is around smaller companies or just innovating companies that don't have MDSAP themselves. What they can do is they can piggyback off other MDSAPs. So there's 2 options there. Number one would be that they find a contract manufacturer that does a similar product that already has under their MDSAP that kind of product. And then once they pick them, obviously it's a business relationship, et cetera. They can have them, and then you have something called a private label licensing. So at the end of the day, what ends up in the market is something with their own name on it, but they've used another company's contract manufacturer's MDSAP for that. The other option is not a contract manufacturer, but an actual manufacturer. And again, that's a business negotiation around whether they end up with a private label or a distribution agreement or whatever it is. But you can definitely piggyback off other companies. Now, if the other company you want to work with don't have they have an MDSAP, but the scope is not, because again, it's not only having an MDSAP, but the scope on that first cover page has to include your product. So if it doesn't, that can also mean that that company you want to work with would then bridge adopt that scope within there. So they would have to have an additional audit, but then again, that's a business negotiation, but it's still less than a company doing it their own. And also the timeline to get this done is much quicker. So that's the first thing I would suggest. The other thing is more around the product. I've seen some products where they have a medical and non-medical benefit, and around an example would be a treadmill with some blood pressure monitoring or heartbeat monitoring. Let's use that as an example, that you can market it for its non-medical purposes and medical. I see a lot of that as well in the software as a medical device arena, etc. So what they can do also is one thing is small businesses are challenges for money. So I would suggest make sure that you don't market it, make sure you don't label it for its healthcare purposes, really for use that first access into Canada as a non-medical. And you have to be very cautious about, again, that's a very clear line in the sand. Don't overstep that. But that's where you're going to get market access. You're going to get some money. You can also use that to see how users like it, modify it a bit, again, all within the non-medical scope, and use that time to get to that point around getting that MDSAP or engaging a company with MDSAP. So that, again, not all companies have that opportunity because of their products. I don't see syringes, for example, having a non-medical use.
Right.
Yeah, arts and crafts, who knows? But within it could be, but within those, some of those products, as I said, some of them have that leeway and use that to maximize benefits. So by the end of the day, when you do get your MDSAP, you get your license, not only now have two sources of revenue, the medical and non-medical, you've had some time to capture user preferences. I don't like this color. I like that color. I don't like it. So that is also another benefit. So those are the two ones I can suggest.
Yeah, absolutely. That's such great feedback. And I think too, as you mentioned, right, we see SAMD just blowing up, right? So many more products in that space, all of the, wearable technologies, all of the therapeutic type, as you're talking about with treadmills or things like that, that maybe have a both non-medical and medical applications. So really good advice on different approaches that someone can take. You also mentioned too earlier, right? Canada's had an interesting evolution with MDSAP because you come from this background with 1345. It's a bit different than some of the other regions, really strong in this area. So are there things that you think have, because of 13485, has that made it much easier in the Canadian market to kind of transition over? It's been more, I think, of a gradual approach maybe than some other places. And I think that's really interesting when we're looking at the Canadian market specifically and how this has kind of evolved over time.
Yes. So it's kind of we've been ingrained to kind of deal with just one system. We never had an option, and so where other countries have options, obviously, us being the sole within the 5 countries having it mandatory, it's a bit challenging, I guess one would say. But I would say that now with the US also changing their quality system to really be very similar to ISO 13485, the benefits that before with the old quality systems that were there for them to stay outside of MDSAP are no longer there. In fact, there's now more benefits to be part of MDSAP as opposed to before. Also with the challenges in Europe around their qualities, all that's happening there, we see more and more companies saying, hey, you know what, MDSAP is actually pretty good.
Yeah, sounds pretty good. Yeah.
Sounds pretty good. So I would say, yeah, so we've had an evolution. I would say the first time, I think around 2005, 2004, when ISO 13485-88 happened, I would say around that time, don't quote me on it. It's been a while. But I think that was the biggest kind of, I won't call it shock to our system, but shock, but very different because before that, it's not like we were audited by Health Canada. There was really, as far as I can recall, again, don't quote me if I'm wrong, but or quote me. There wasn't really a formal quality system, and I think it was like a fork in the road where Health Canada had to decide whether they would create this internal system or contract it out and create a different system. And they decided to create that different system, and it was CAMDCAS. And so we provided that feedback into what today is the MDSAP program, and why it is so successful today is because, it didn't start suddenly a few years ago with all 5 countries. It really started with Canada all throughout the year, learning, evolving, and then expanding. So it is a huge success story. I will call it, maybe other regulators won't agree, but I'll call it a huge Canadian success story.
Yeah.
Right? So that I think that are my perspective on that.
Well, and then when we think to the future too, right? So we talked about it a little bit with the MDSAP program, obviously the 5 countries plus some affiliate members. I mean, are there things you see as this is evolving, right? You're spending a lot of time working in these groups, working with the other members, but what's the future, right? Are there going to be more countries joining? Is the goal, right? I know there's a lot of close ties, of course, between MDSAP and the IMDRF for harmonization, right? Obviously this came out of that. So what do you think when you're thinking about, the future of the MDSAP program and expanding outside of the kind of core five, and what that might look like?
Yeah, absolutely. So, as part of this, the last iteration of the survey, there was a couple of things that both industry and the regulators wanted to hear from. And I would say regulators, it was TGA obviously supporting it, but it's something that we knew that the regulator wanted to know is like, where do you want to see this next? Because it has to be a collaboration. If the regulators say we're going to do it, I don't know, some other country, which I won't name, but any country, and the industry says that's not of interest to us, nobody will adopt that country, and that will not, there will be an effort wasted. So obviously we want to hear what does industry want to see, and then obviously what the regulators want to see as well. And we are in alignment. It's Europe will be the next big place where we want to see MDSAP being accepted and implemented. And so that was very loud and clear in our survey. The next one was interesting, was Korea, and the next
Oh,
one
okay.
is UK. And then it went, but again, keep in mind that our survey was, although it was very successful, it was very small because we only had about a month and a half to get feedback. So I can't say it represents the vast majority of industry. This response, it represents the vast majority of the responses we received to that point. But again, that first answer, Europe wasn't a surprise.
Of course, yeah. Yeah, and I mean, I think, as we're looking at this idea of global alignment, global harmonization, reliance, right, really pushing towards all of these things, with the European market being such a huge target market for so many manufacturers. Additionally, when you think it's, we kind of chatted about briefly earlier, the big transitions that have happened in Europe with the MDR, right? There's just been a lot of focus on the European market, and, being able to expand a program like this to really support, the European market itself would be huge for the industry, right? Huge for the program, but huge for industry as well, since we see, the world is getting smaller, right? Manufacturers are shipping their products all over the world. They're considering all of these different markets, and anything we can do to make it easier, faster, right? More accessible, better health equity, right? Anything we can do to move towards that is big strides for our industry.
Yeah, absolutely.
Yeah, wonderful. Well, is there anything you want to share in terms of the global alignment, or anything that you're seeing or thinking as we're kind of moving towards all of those goals from an industry perspective? Anything that you would like to maybe share or expand upon related to that?
Well, I think you hit some of them when you're just mentioning right now. One of them is multiple access point and access. Access of healthcare to countries. It has two levels. It has the company has to have the quality system for certain products. In Canada, it's class 2 to 4, and even for class 1, but it's a different one. I won't bridge on that. It's MDL, but also the product licensing. And so alignment for MDSAP will cover that one basis and will really help even in cases of shortages. I mean, the benefits to it are just, I can go on and all the benefits, but it would just, the more countries engage, the more regions engage in it, the more we can provide access almost at the same time, barring that licensing hiccup, not like it's different for each one, right? Something that's a class 1 in Canada might not be in Europe, might not be in US. So we can't, that is a different, that's where IMDRF comes into play. But from an MDSAP perspective, it would be that piece would have alignment. And that's a huge journey. To get an MDSAP, you're looking about a year or more before you can even apply, because you can't do this in parallel. So that would cover that gap. Huge improvement for there. And all the benefits I mentioned before would just be seen in more countries, ability to choose your AO. At this point, no surprise audits, although I do know that regulations change. So today it's no, tomorrow it's yes. So, but
Yes,
now,
right. Yeah.
for now, again, more and more reduced costs. I mean, the same company, the more countries that join this MDSAP program, the cheaper it will be for them. And they will have done nothing more than add that one extra country to the MDSAP. So I think that it's beneficial to all industry to be part of this program, understanding, as I said, and I always say, there's always room for improvement. So not only joining the program, but also joining the feedback loop of this program that we're working on with the AOs and the regulators as well.
Absolutely. I think that's such a good point, right? It's not just this one and done idea, right? It is this idea of continuous improvement and taking that feedback and continuing to, evolve what the program is doing, especially as we see, the world changing so rapidly.
Yep. Yeah, absolutely.
Well, Mia, it was so wonderful to have you join us today. Really appreciate your time. Tell everybody, where can they find you? Where can they find MedTech Canada? Obviously, a great organization that you're a part of.
Oh, yes. So we're located in Canada and we're Toronto, but we're mostly virtual, so we can access all across Canada. You can access us to our website, medtechcanada.org. You can reach out to me directly. I'm on LinkedIn. I do answer LinkedIn messages. And I would love to speak more about this. I think the one thing we can do is just spread the word around the survey, spread around if you are part of an association. Please reach out to your association, have them reach out to me because I would want the whole idea is that we get as much feedback from as many associations to support this ongoing loop of feedback and collaboration and transparency and engagement. I mean, everybody is excited about this. The AOs are excited about this. The regulators are excited about this. The industry, there's very few opportunities that will tell you where everybody is excited about something. And, those ones outside of quality, but like, what is everybody excited about? But this is very exciting. It's very exciting because at least in Canada, we've had a quality system such as this, I would say almost for 20 years. And it is now that we're creating this method to get this joint feedback with data that we can actually see, look at, collaborate, and improve on. And everybody wants to participate in it. So this is a very exciting time for us. And it's very timely as well, because as we get bigger, now is the time to capture the data, because when it gets bigger, it gets harder to get. I sometimes say herding cats.
Yeah, that is absolutely true.
Right? We have 5 cats. Before we get any more cats, getting the right parameters in place, the right structure. Also part of that survey was the MDSAP website is moving, I believe, from the FDA platform to its own. And even within that, TGA wanted to make sure that we receive feedback from industries like what would work from them with regards to understanding and learning and training. And so would you like a wiki page? Would you like this? So really, it's such a feel-good opportunity and collaborative effort. We want everybody to be engaged because it's for everybody's benefit.
Yeah, so true. And I think that's just the best part of our industry, right? Is it's become so collaborative with everybody from the regulators to the manufacturers to these, right? Everyone is just working together, which is just so phenomenal to see. Well, Mia, it was so fun to have you on today. Thank you so much for joining. And again, if anyone has questions, please reach out and we're happy to connect you with Mia. Thanks so much.
Thank you, Clarissa, and thank you for setting this up.